Ever wondered how influenza, also known as the flu, affects millions of people worldwide each year? It's a question that often lingers in our minds, especially during flu season. Influenza, a formidable adversary of our immune system, is caused by a group of viruses that target our respiratory tract. This leads to an array of symptoms that can make us feel as if we've been hit by a truck. But what is it that makes influenza such a prevalent disease? How does it manage to outsmart our bodies time and again, causing us to fall ill? More importantly, how can we fight back? These are some of the intriguing questions we'll be exploring as we delve into the world of influenza. In the coming minutes, we'll be taking a closer look at the causes, symptoms, and treatment of influenza, shedding light on this common yet fascinating aility. So, buckle up and get ready as we unfold the mystery behind this common yet intriguing ailment. Influenza, a name we've all heard, but what causes it? The culprit behind this common illness is a group of viruses known as influenza viruses, specifically types A, B, and C. Each type has its unique characteristics and potential for harm. Type A influenza viruses are the most virulent, responsible for most flu epidemics. They have a knack for mutation, leading to new strains that can spread quickly among humans. This is the reason why you need a new flu shot every year. Type B influenza viruses are less common and typically result in a milder form of the flu. However, don't underestimate them. They can still cause outbreaks and severe illness. Type C influenza viruses are the least severe and usually cause mild respiratory symptoms or none at all. But again, mild doesn't mean harmless. So how do these viruses spread? They're airborne, expelled from the body through coughs or sneezes, and can live on surfaces for a short time. If you touch a contaminated surface and then touch your face, you can inadvertently invite the virus into your body. Once in the body, the influenza viruses target the respiratory tract. They latch onto cells, take over their machinery, and start churning out more viruses. This invasion triggers a response from our immune system, leading to the symptoms we associate with the flu. Now that we know the culprit, let's explore how it manifests in the body. What happens when the influenza virus invades your body? This is where the battle begins and the body's immune response kicks in, exhibiting various symptoms that we commonly associate with the flu. The influenza virus primarily targets the respiratory system. Consequently, the first signs often involve a sudden onset of fever, accompanied by a dry cough. However, these symptoms can quickly escalate and affect the entire body. It's not unusual for afflicted individuals to experience body aches, headaches, and a general sense of fatigue. A sore throat is another common indicator of influenza, which can make swallowing a painful ordeal. Some people may also experience gastrointestinal issues. Nausea, vomiting, and diarrhea, although less common, are particularly prevalent among children with this flu. It's important to note that these symptoms can range from mild to severe. While most people recover within a week or two, influenza can sometimes lead to severe complications such as pneumonia, particularly in high-risk groups like the elderly, young children, pregnant women, and individuals with chronic health conditions. In such cases, immediate medical attention is crucial. Remember, while the flu is a common illness, it should never be taken lightly. Timely intervention can make a significant difference in the course of the illness. Symptoms can be daunting, but there's always a way to fight back. In the next segment, we'll discuss the treatment and prevention measures to keep the influenza virus at bay. Stay tuned. So, how do we combat this pervasive virus? This is a question often asked when dealing with influenza. The answer lies in a two-pronged approach: treatment and prevention. Let's start with treatment. Once an individual has been infected with the influenza virus, the primary goal becomes managing symptoms and fostering a speedy recovery. This involves a combination of rest, hydration, and medication. Rest is vital, as it allows the body to use its energy to fight off the virus. Hydration is equally important, as fever and sweating can lead to fluid loss. Drinking plenty of water, juice, or warm soup can help replace these lost fluids and soothe a sore throat. Medication also plays a significant role in influenza treatment. Over-the-counter medications can alleviate symptoms like fever, body aches, and headaches. However, these should always be taken as directed by a healthcare professional. It's also essential to stay home and isolate from others to prevent the spread of the virus. Now, let's talk about prevention. Prevention is always better than cure. And in the case of influenza, it's no different. Simple habits like regular hand washing can significantly reduce the risk of infection. It's also advisable to avoid close contact with individuals who are sick, as the virus spreads easily through respiratory droplets. But perhaps the most critical preventive measure against influenza is vaccination. The flu vaccine is updated every year to protect against the most common strains circulating that season. Getting vaccinated not only reduces your risk of getting the flu, but also lessens the severity of symptoms if you do get infected. Influenza is indeed a formidable foe, but with knowledge and precautions, it can be tackled effectively. Remember, the key to fighting flu is a combination of effective treatment measures and proactive prevention strategies. So let's stay informed, stay healthy, and keep those viruses at bay. Remember, an ounce of prevention is worth a pound of cure. So, what have we learned about influenza today? We've discovered that influenza, or the flu, is a viral illness caused by influenza viruses A, B, and C. These microscopic culprits are transmitted through the air, easily passing from person to person, and once within the body, they wage war on the respiratory tract, causing a plethora of symptoms. Symptoms can range from mild to severe, encompassing fever, cough, body aches, fatigue, headache, and even gastrointestinal issues. Treatment focuses on alleviating these symptoms, ensuring adequate rest and fluid intake, and importantly, preventing the spread of the virus to others. We've also understood the importance of prevention, which includes regular hand washing, avoiding contact with sick individuals, and receiving the annual influenza vaccine, designed to provide protection against the latest strains. Remember, knowledge is power. Stay informed, stay healthy.